First, let's just define what DPD actually is.
Depersonalization disorder has been in all the diagnostic manuals around the world for decades. It's been studied for about 100 years. And in the DSM, which is the Diagnostic and Statistical Manual of Mental Disease,
big fat book that all the shrinks look at.
Yeah, it's listed there under dissociative disorders. But in England and the rest of the world, it's under different anxiety disorders and things. So there's a little discussion as to where it should be.
I guess that's why we really haven't heard about it a lot.
Well, one reason that we haven't heard about it was relatively obscure until the last 30 years or so. It was caused primarily by low-level stress and people who had a predisposition towards it. But they found in the last few decades that it can be triggered by certain drugs. And these drugs include marijuana, ketamine, and predominantly ecstasy.
And then the things you name, a lot of recreational drugs that students are taking right now.
Well, the use of ecstasy in the last 2 years has grown 67%. Now that's a dramatic increase, and ecstasy is one of the primary culprits that can trigger DPD.
So you found through your research and others' research that there are kids out there just using these drugs here and there, and this can trigger DPD?
If there is a predisposition in an individual towards depersonalization, it will trigger it, or it can trigger it. There are many people who develop depersonalization disorder with no known trigger at all.
No, you went through this yourself.
I went through this for 11 years back in the 70s, and oddly enough, it takes a person an average of 11 years to find a correct diagnosis of
Describe
DPD.
what you were going through, the feelings you had before you knew what exactly it was.
One of the things about depersonalization disorder is that it's virtually indescribable. So people have to describe it in terms of as-if metaphors.
Okay.
So it's as if I'm losing my mind. It's as if my mind is separate from my body, which is a dissociative aspect of it. There's also a period of emotional numbing. It's as if I have no emotions, and basically the loss of the self. I feel as if I have no self, I have no personality, yet you're always aware of this. It's a phrase.
But not a depression,
It's not depression,
like
although many thousands of people have been misdiagnosed with depression or with any number of other mental illnesses when in fact they're suffering from depersonalization disorder.
So is this something in families where it runs in the family of depression or mental illness that DPD could also surface?
There is some evidence that it can be in a family, but there are many, many cases where there is no evidence in the past at all of any kind of mental illness. And I said, obviously there are many people who do all kinds of drugs all day long and remain immune to it. But there is in the brain a predisposition towards DPD in many people. We don't know the exact number of people, and these things can trigger it, but so can various degrees of stress.
During the 11 years you were dealing with it, how long before you realized or were diagnosed and got some help?
It was 11 years until I received the diagnosis. I managed to meet a very brilliant psychiatrist when I was living in California who was familiar with it. And to date, there are still very, very few specialists around the world who are familiar with it. Now, what happened in the 1990s, it began to come out of the woodwork with websites that people created for sufferers of depersonalization with information about it and research. And that's what's kind of changed the whole face of it. To my knowledge, this is the first television show in history to actually mention the term depersonalization disorder.
Making history here.
You may be making history, and hopefully it'll continue.
How do people know that others are going through it? Because the characteristics that you described were so broad about what you were feeling, and obviously they could be diagnosed as depression and a number of other things with doctors and their patients. Can other people, like when you were going through that, would I be able to see it in you if I was a friend?
Very often friends, family never suspect that anything is wrong, because people with depersonalization become masters at maintaining a front, putting up the normal appearance. One of the symptoms of it is people feel as if they're acting like a robot, as if they no longer have a soul, but they're just going through the motions of life. So they are still able to go through the emotions of life. The only difference is they may not laugh as much, they may seem more withdrawn or preoccupied. Because excessive rumination is also a symptom of it. There is an over-consciousness of the self on the self.